all, Nikki, thank you very much for being here today and accepting to participate in our conference. So we're going to have a little talk and see, we'll learn a little bit more about you. So can you start by introducing yourself?
Yes, absolutely. Hi, I'm Nikki. I'm a licensed occupational therapist and lead ergonomic specialist at the Rising Workplace. And my background, foremost, is in healthcare. And then I've moved with my business, the Rising Workplace, over the past 10 or 11 years doing consulting for injury prevention and ergonomics using that healthcare perspective.
Okay, that's great. Well, that's really what we're looking for because I really, really wanted this conference to have like real specialists because us groomers, we have a tendency to stay, between us, groomers talking to groomer. So I really wanted to have really people like you who know their business, because
Absolutely.
so, um, well, you're going to talk about ergonomics during the conference. So, can you explain to us exactly what ergonomics means?
Absolutely. So, ergonomics is all about the science of fitting your work environment and your job tasks to the human and not the other way around. And when we have an ideal match between the human, the work environment, and the job tasks, then we are reducing our likelihood of injury and enhancing our performance at work.
Yes, because we have a lot of problem, regarding the health survey that we made with the International Grooming Society. We noticed, well, we knew already, but it's always better to have it in writing, in data. And a lot of groomers have a lot of back issues, wrist issues, well, a lot of different body issues. So I think it is very important for them to understand, so what are some workplace challenges for professional, and for groomers to have all these repetitive work every day, lifting the dogs, etc.
Yes. Yes. And I think we know within the field of grooming that it is a high risk activity because you're likely facing a high early retirement rate, changing jobs mid-career due to a high level of musculoskeletal disorders that develop because of the wear and tear over time. And it's under recognized. So, whereas you'll see in the literature and the research, there's plenty of studies now coming out about dentistry and surgeons and professions that essentially face the same risk factors as groomers. And so many of the things that you mentioned, it's lifting, the force of manual handling an animal, which is different than warehouse, right? Because this is also unpredictable. It's a moving thing. It's not, it's even higher risk because of that unpredictability factor. So lifting and moving objects, animals, vibrating tools is a big one. Again, dentistry and surgeons face the same risk factors. So do groomers. Anybody that use a vibrating tool can pose a risk. Working in awkward positions, having to work your way around the animal, reaching, bending, twisting, and then repetitive movements. And so all of that is kind of over time accumulates in wear and tear and stress on the body. And so those are our distinct risk factors as it relates to grooming and many other professions as well. But grooming really stands out to me just based on my awareness of the job activities that are required to be a groomer.
Yes, you're right. So true. So without revealing too much for now, because we want to keep the surprise for October, can you tell us what groomers can expect from your session?
Yes, so I'd like to share more about the dilemma of musculoskeletal disorders and how they develop. And most importantly, what are our protective specific strategies that we can apply day to day? So I'm hoping that we can get some background and basics on ergonomics and our risk factors, but also move towards, okay, now that I know that we all share a problem, what can I do about it? What can I do in my work practice every single day to protect myself against the likelihood of injury?
That's great. So people are going to walk out of this session with practical information that they can apply directly.
That's the goal. Yes.
That's the goal. Fantastic.
Yes.
Well, your company is called the Rising Workplace. So, and you provide ergonomic services to different fields, different companies, different fields. So, could you tell us a little bit more about your work and the types of professionals and workplace you support?
Sure. So we perform all types of assessment, education, and consulting services for all types of workplaces. Some of our common clients might be office settings. So, as you can imagine, computer workstation users face repetitive stress, sedentary, awkward postures, some of those risk factors I mentioned as well. And also within the industrial sector. So, you'll see more of that. You can imagine if you're working on an assembly line, you're also doing repetitive movement with vibrating tools and so forth, or maybe lifting and moving of boxes. And so we work within office, industrial, medical. Really, there's no job that's immune to the stress of musculoskeletal disorders. And so I've had some really interesting clients over the years, and it applies across the board to work and to life.
And what are the outcomes, when you guide these people, these companies, what are the outcomes they can see, they can benefit?
Yes, and from a business perspective, it's reduction in workers' compensation spend or reduction in recordable injuries that workplaces have to report. But even more importantly, at a personal level, you are decreasing your employees' discomfort and increasing their morale and their satisfaction so that you can retain workers. Because if you're uncomfortable and you're experiencing pain and discomfort, you won't be a champion for the company, and chances are it will impact your quality of life in many different ways, work and beyond.
Yes, or as a groomer of with your own company, you quit and you change because you are exhausted and your body cannot take it anymore. So that's
Exactly.
that's great. So what message would you like to share with groomers who think that pain and fatigue is just like part of the job?
Sure. Well, by definition, ergonomic injury type of injuries are preventable and avoidable. And so we shouldn't accept that as a reality. We have one body in this life, to my knowledge, and we can't go like when you buy a new car, go buy a new one when our body runs out, right? And so it's thinking about our long-term health, thinking about our future, our retirement, our quality of life. These are all incredibly important factors. And myself, I'm in a healthcare helping field. Actually, I should have mentioned early on too. My first work experience before I went to um, my graduate and undergraduate studies is that I worked as a veterinary technician. And so I love animals. I've worked with animals, and I know many people that enter that industry are caregivers. They're used to helping other people, and they don't necessarily help themselves first. So this message is about putting your own life preserver on before putting it on anybody else, or making sure you take care of yourself while you're taking care of all your clients as well.
That's true. That's true. Very, very true. And I'm trying, to shout it out loud all the time, but nobody's listening. So hopefully they will listen to you. So why do you think groomers should join this conference, the Global Groomer Health Conference this year?
Because you might take away something new that can really make a profound impact on your health at work. And although you are a true expert in your field, and there's many things that you pick up through industry knowledge and experience, this conference and its focus on worker health may help you put a different spin on how you think about your work in a way that can really enhance the way that you work, and also, again, the longevity of staying within the career.
Well, thank you. Thank you very much, Nikki. Thank you for being there and thank you for joining the conference. So, well, it's been very interesting, and I guess we'll see you in October.
I'm so excited. Thank you so much.
Thank you.